Welcome. This video will provide information on eligibility requirements for a number of frequently used special coverage types. It is not a comprehensive list. For more information on other special coverage types, please visit the Nevada Medicaid website at www.medicaid.nv.gov. This video is broken into 5 sections. Section 1 will focus on qualified Medicare beneficiaries, also known as QMB. Section 2 will provide an overview of special low-income Medicare beneficiaries, SLMB, and/or qualified individuals, QI. Emergency medical for non-citizens will be covered in Section 3. Section 4 covers managed care organizations, MCO. Lastly, information on pregnancy coverage will be provided in Section 5. First, this video will provide information on qualified Medicare beneficiaries or QMB. Qualified Medicare beneficiaries, also known as QMB, are Medicare recipients with income at or below 100% of the federal poverty level. If a recipient has the QMB benefit line, Medicaid will only pay coinsurance and/or the deductible left by Medicare up to the Medicaid allowed amount. The recipient cannot be billed for Medicare-covered services. When a member does not have a fee-for-service (FFS) benefit line, the claim must be submitted as a crossover claim type. Medicare replacement plans are included and the copay belongs in the coinsurance field of the crossover details section. Section 2 will provide an overview of special low-income Medicare beneficiaries, SLMB, and/or qualified individuals, QI. For these two special coverages, Medicaid pays the recipient's Medicare premiums. Medicaid does not pay as a secondary for this coverage type. The recipient may only be billed if this is the only benefit line present. The difference between SLMB and QI is the percentage of income. As a note, if a recipient has QMB coverage in addition to other benefits, such as SLMB or QI, then QMB billing rules apply. Next, eligibility for emergency medical coverage for non-citizens will be covered. For emergency medical non-citizens coverage, recipients are covered in situations where they are at risk of losing life, limb, and/or in extreme pain. If the diagnosis code isn't found on the predetermined list of ICD-10 codes that are covered for EMO coverage, the claims must be submitted with an attachment to document the emergent criteria. This applies to professional or outpatient claims without an inpatient place of service. For inpatient services, emergency criteria is documented through a prior authorization or PA. For professional claims with an inpatient place of service, only dates that are approved for the inpatient stay may be reimbursed. Any service rendered once the recipient is stable, including follow-up care, is not covered. In Section 4, an overview of managed care organizations, also known as MCOs, will be provided. Recipients residing in urban Clark or Washoe County that do not have conditions that qualify them for Medicaid fee-for-service are required to enroll with a Medicaid MCO. If the recipient is enrolled in an MCO plan, claims must be submitted to the appropriate plan. There are exceptions, including ground EMT transportation, so please see your provider's specific billing guidelines for more information. Additionally, Medicaid fee-for-service is not a secondary payer to MCO coverage. Lastly, an overview of pregnancy is covered in Section 5. Recipients with the pregnancy benefit line are eligible for services directly related to their pregnancy. This benefit must appear in addition to Medicaid fee-for-service benefits in order for services to be payable. For additional resources on special coverage eligibility, visit the Nevada Medicaid website at www.medicaid.nv.gov. There you will find the EVS user manual. Chapter 2 will provide detailed information on eligibility benefit verification. In the provider training section, you will find a link to our YouTube channel titled Nevada Medicaid. The Using the Electronic Verification System, EVS, playlist contains a video on the Eligibility tab titled Part 3 of 11, Eligibility tab. If you navigate to the Providers tab on the Nevada Medicaid website and click Billing Information from the drop-down, there you will find Emergency Medicaid, EMO, billing guidelines and provider type-specific billing guidelines. This concludes the video on understanding eligibility for frequently used special coverages. Should you have any questions, please reach out to Nevada Provider Training at gainwelltechnologies.com. For more information on any of the topics covered in this video or for further training opportunities, please visit our website at www.medicaid.nv.gov.